Hey guys, thanks for checking out this video. I wanted to do something a little bit different today. I wanted to talk about glaucoma, which is the disease that I have. But more than just talk about glaucoma, I wanted to propose an idea that I had on how to actually better control the eye pressures that go up for people that are currently diagnosed with glaucoma, that have been going through it for a long time. As glaucoma patients, we go into the doctor, they take our eye pressures. For me, I have open angle glaucoma. So for me, they want to see those eye pressures probably somewhere between like 10 and 15 would be like the ideal range for eye pressures. Anything over 20, you're getting yourself into some trouble there where more damage can occur and your optic nerves can start to deteriorate even more than they already are. For myself, glaucoma has completely taken away my vision. I am now completely blind. I've been blind now for about 1 year. I was diagnosed with open angle glaucoma back in December of 2010. I had partial vision all the way up through about January, February of 2018. I had no vision in my left eye, but I had about 20 to 25% functional vision in my right eye, so I was still able to do a lot of things. However, the glaucoma disease took a toll on me, and it deteriorated my right eye from there, and I lost the remainder of my vision. Now, taking all of the appropriate eye drops that I was supposed to be taking, the pills that I was supposed to be taking, as far as the eye drops I was taking, I still take timolol, brimonidine, dorzolamide. I'm also on Vyzulta and the eye pills known as acetazolamide. Those are all the medications that I'm currently taking right now. I've also had the laser treatments done to my eyes before to help lower the pressures. When I was originally diagnosed with glaucoma back in December of 2010, I had eye pressures were like in a 40 and 50. And the doctors told me that, they don't know how long that could have been going on. That could have been going on for years, but it didn't take any of my sight at the time until I started noticing it in December of 2010, where it completely wiped out my vision in my left eye in the span of about a week or two. So that was super fast. But my glaucoma specialist has talked a lot about pressure spikes, and this is what I really wanted to address, the topic of this video, and how you can go into the doctor, you can get your eye pressures taken, and you could be fine. You could be a 11 in your right eye, a 12 in your left eye, but then you're losing vision. He talked about there can sometimes be pressure spikes where the pressures can go up at random times, but those are times where you're not there at the doctor to actually get that test done. And the problem that I have is that I think that glaucoma patients should have access to in-home eye pressure test kits, or whatever you want to call them, but that we should be able to test our own eye pressure, because if we don't, we're at risk of our eye pressures going way up for the times that we're not going to our doctors. I mean, sometimes your appointments can be spread out, at least for me it was, because I was consistent for so long. There could be times where your appointments are spread out 2-3 months before you're actually going back for additional pressure checks. So in that span of time where you're not getting tested, who knows, your pressures might be going up and you won't have any way of knowing it, and then all of a sudden you're losing more vision. And so I really think that, something has to be done in order to get glaucoma patients some sort of in-home pressure testing kits for their own eyes. You have people that can, check their own blood pressure and do other tests from home. People who are diabetic and have other diseases where they have to check that stuff daily. I think it's just as important for people who have glaucoma. I think that they should check their eye pressures daily. I think it's pivotal, because that's how quick that disease can just steal your sight. It did it for me. It will cause you to go blind if not monitored constantly. And if these pressure spikes are taking place, then I think that we need to have some sort of, like I said, an eye pressure testing kit to where, we can do that from home. Now, I understand there's costs and everything like that, and that could take some time, but I want to throw that out there because I don't know if it's ever been pitched. And I talked about it with my eye doctor a couple of times, and he just said there's nothing like that out there right now. Now, maybe there is, and I just don't know about it, or maybe it's, outside of the United States where I'm at. But we're talking about saving vision here. We're talking about saving your sight, and I think that is so important. This is an aggressive disease, and I think a lot of times glaucoma and other types of eye diseases are overlooked because they're not fatal, because they don't kill you. But what people don't understand is that it hurts you and kills you emotionally at times. I mean, I've had to watch over the last year my entire world fade away from me. Everything that I love, the people that I love, just everything that I love to do. You know, I can't look at the sky anymore. I can't see the clouds. I can't see the rain, the sunshine. Nothing. There's nothing I can see any longer. Now, had there been some sort of an in-home testing kit to check eye pressures, possibly then it would have noticed like, uh-oh, my eye pressures are at a 25. I need to make an appointment. I mean, that should be what it's used for. So if you're checking them daily and you're noticing that they're going way above what they should be, you can make an immediate appointment then to go see your glaucoma specialist and have it checked out and see what's going on. If they need to do some more laser treatments for you, give you additional medication, whatever the case may be. I just think that it's too aggressive of a disease to not look into something like this. If people are going blind for no reason, they don't have to. We need to change that. We need to do something to change that. Because I mean, like myself, and I'm sure there's others of you out there that have maybe experienced the same thing, but maybe we can save other people from having to go through what we've had, from having to go blind themselves because of pressure spikes, from gaps in times from appointments where you're not going in there. And who knows, your eye pressures spike up to 30, 40, who knows what may happen. But I think this is something that we seriously need to look into. I want to know what you guys think about this. I don't normally talk about this stuff on my channel, but because because I am somebody that has glaucoma and I have gone blind from it, I just wanted to throw this out there and see if this would connect with others out there in the blind community who are possibly going through the same thing as me, or maybe know of some solutions and suggestions themselves. I mean, ultimately, we want to push for a cure, guys. That's what we want. We need a cure. We need to find a way to regenerate the optic nerves in the eyes for people who are glaucoma, where the optic nerves are dead, and right now there's no way to regenerate those nerves in order to bring our sight back. But that's ultimate goal. That's the ultimate goal we need to do, is that we need to find a way to bring those optic nerves back and reverse this terrible disease that I don't think gets talked about hardly enough. I really don't. But I will leave it there, guys. That's what I wanted to talk about. Let's see what we can do. Let's contact whoever we need to in order to possibly get, in-home eye pressure testing kits, so that those with glaucoma, we can monitor ourselves and then we can call our doctors if we're experiencing pressure spikes. Let's save our vision. That's what this is all about. Let's save our vision. But guys, thank you so much for watching this video. If you don't mind giving this video a like, and please also share this video with your friends and family, especially for those that have glaucoma or other types of eye diseases. And let's see what you guys have to say in the comment section down below. I'll be back with more. You guys take care. Please be safe out there. God bless each and every single one of you, and I will talk with you soon.